Have you ever felt that quiet moment of worry when a health headline appears and your heart pauses for a second? One of my patients once shared that she read the words human transmission and could not sleep that night. I want you to imagine this. You are sitting across from your doctor, asking a simple question. Should I be worried? I am Dr. Evelyn Carter, and I have spent decades caring for older adults and their families. When topics like Nipah virus appear in the news, they often arrive without context, without calm explanation, and without reassurance. Understanding Nipah virus human transmission is not about fear. It is about clarity, balance, and knowing what truly matters for your health. Nipah virus is a rare virus that scientists and public health experts study carefully. It shows up in medical discussions from time to time because researchers want to stay prepared, not because danger is suddenly near. The phrase human transmission can sound alarming, especially for seniors who have lived through many health scares over the years. In my experience, fear usually grows when information feels incomplete, not when risk is truly high. Many of my older patients look at me and ask, "Should I be worried?" My answer often begins the same way. Let us slow down and look at what science actually shows. Medicine is not about dramatic headlines. It is about evidence, patterns, and real-world experience. Most risks are far more specific and limited than they first appear. This video was created especially for seniors and caregivers. We will speak calmly, clearly, and with respect for your life experience. There is no urgency here, no pressure, and no judgment. Only steady information you can trust. In the next part, we will gently explore what science says about Nipah virus human transmission and why understanding does not require changing how you live your daily life. If this kind of calm, science-based guidance helps you feel more at ease, please consider subscribing to Senior Health Daily, liking this video, and sharing it with someone you care about. Your support allows us to continue creating thoughtful, reassuring health content made especially for you. What science says about Nipah virus. When we talk about what science says about Nipah virus, it helps to begin with how medical knowledge is actually built. Science does not move through headlines. It moves through careful observation, repeated studies, and quiet collaboration among doctors and researchers across many countries. Most of what we know about Nipah virus comes from years of monitoring, laboratory research, and real-world clinical experience, rather than sudden discoveries. Nipah virus was first identified because doctors noticed a pattern that did not fit common illnesses. Patients shared certain symptoms, and those symptoms were traced back through careful investigation. From there, scientists began studying how the virus behaves in the body, how it moves between hosts, and under what conditions it becomes a concern. This process takes time, patience, and constant verification. That is very different from how news stories often present information. In the media, complex science is usually compressed into a few dramatic phrases. Words like outbreak or transmission can appear without explanation. For someone watching from home, especially an older adult who values stability and routine, this can feel unsettling. In my years of practice, I have seen many patients react not to the science itself, but to the absence of context around it. Science speaks in details. Headlines speak in urgency. What science tells us is that Nipah virus is rare and studied precisely because it is uncommon. Researchers focus on understanding its behavior so that health systems can stay prepared, not because it poses a constant threat to everyday life. The scientific community pays close attention to how viruses interact with the human body, but attention does not equal danger. It often means prevention, planning, and protection. I often explain to my patients that scientific data lives in probabilities, not certainties. A possibility described in a research paper does not mean an event is likely to occur in daily life. Science asks careful questions like, under what conditions and how often? News stories often skip those questions entirely. Understanding this difference can be deeply reassuring. When you hear that scientists are studying Nipah virus, it does not mean something new is spreading unnoticed. It means systems are working quietly in the background. For seniors and caregivers, this distinction matters. It allows you to replace anxiety with understanding and to trust that knowledge grows not from fear, but from steady, thoughtful inquiry. How Nipah virus transmission is explained. When people hear the word transmission, the mind often fills in the gaps with everyday situations. A handshake, a shared meal, sitting near someone in a waiting room. In my experience, this is where worry quietly begins. So let us slow down and talk about how Nipah virus transmission is actually explained in medicine, using simple language and real context. Viruses do not all move the same way. Some spread easily through casual contact. Others require very specific conditions. Nipah virus belongs to the second group. Scientists have learned that transmission depends on close and prolonged exposure, usually involving bodily fluids, and often in healthcare or caregiving settings where someone is already very ill. This is not the kind of contact most people experience in their daily routines. I often tell my patients to think of transmission as a chain that needs several strong links to hold together. If even one link is missing, the chain breaks. With Nipah virus, those links include direct exposure, lack of protective measures, and very specific circumstances. Simply being near someone, shopping for groceries, or spending time with family does not complete that chain. In clinical settings where Nipah virus has been studied, transmission between humans has occurred in limited situations. These usually involved close caregiving without proper protection or prolonged exposure during severe illness. Even then, the spread was not widespread. This is an important detail that rarely makes it into public conversation. The virus does not move freely through communities. It requires opportunity, and that opportunity is uncommon. From a scientific perspective, this is why researchers are precise with their language. They say can spread rather than spreads easily. That difference matters. Can means under certain conditions, not under normal life. As a doctor, I have seen how much relief this understanding brings to older adults. Many realize that the activities that give their lives meaning are not the problem. Daily habits like cooking at home, visiting loved ones, attending appointments, or enjoying a walk remain safe. Our bodies are designed to live within routines, and our health depends on that sense of normalcy. When science explains transmission, it does so to define boundaries, not to alarm. Understanding how Nipah virus transmission is explained allows you to place it where it belongs. It is a topic of medical preparedness, not a threat hovering over daily life. When knowledge is clear, fear loses its grip, and confidence quietly returns. Nipah virus spread between humans. When we talk about Nipah virus spread between humans, it is important to be very precise about what has actually been observed. In medicine, we rely on documented cases, not assumptions. Human-to-human transmission has been recorded, but only in very specific moments and under clearly defined conditions. This distinction is where reassurance begins. The cases that scientists reference come from situations where individuals were caring for someone who was already seriously ill. These were often close family members or healthcare workers who had prolonged, direct exposure during advanced stages of illness. In these moments, the body is shedding more virus, and contact is intense and sustained. This is not casual contact. It is not brief interaction. It is not daily social life. In my years of caring for older adults, I have seen how quickly worry can grow when this context is missing. Patients sometimes imagine that transmission happened in crowded places or through ordinary conversation. That is not what the evidence shows. The recorded cases occurred in limited settings where protection was absent and exposure was repeated over time. Another reason these cases are so limited is that Nipah virus does not adapt easily to spreading between humans. Some viruses are highly efficient at moving through populations. Nipah virus is not built that way. It does not spread through the air in everyday environments, and it does not pass easily from person to person. This biological limitation is one of the reasons outbreaks have remained contained. Public health responses also play a role. When a case is identified, Monitoring begins quickly. Care protocols are adjusted. Protective measures are introduced. These steps dramatically reduce further spread. In many documented situations, once awareness increased, transmission stopped. That tells us something important. Knowledge and simple precautions are powerful. I often remind my patients that rare does not mean ignored. It means watched carefully. The reason you hear about these cases at all is because health systems are paying attention. They study the few examples so they can protect the many. That is a sign of vigilance, not vulnerability. For seniors and caregivers, this understanding brings relief. Nipah virus spread between humans has not occurred in ordinary daily settings. It has not moved quietly through communities. It has appeared briefly in narrow circumstances and then faded once those circumstances changed. When you place these facts side by side, the picture becomes calmer. Human-to-human transmission exists as a medical observation, not as a daily risk. Knowing when and why it happened allows you to let go of imagined danger and return to what truly supports health. Steady routines, meaningful connection, and trust in systems that are quietly doing their work. Person-to-person spread in real life. When people ask me how person-to-person spread works in real life, I often begin by describing the difference between closeness and casual contact. In medicine, those two ideas are not the same. Nipah virus transmission between people has been associated with very close, sustained exposure, most often in settings where someone is receiving intensive care during serious illness. This kind of contact involves bodily fluids, repeated caregiving tasks, and long periods spent at the bedside. It is not the brief interactions that fill our days. In real clinical environments, this means situations like feeding a patient who cannot swallow, cleaning secretions, or providing hands-on support without protective equipment. These moments require intimacy and time. They are acts of care, not everyday social behavior. When protection is absent and exposure continues, the chance of transmission increases. That is the reality science describes. I have sat with caregivers who worry they might bring something home simply by being near someone who is sick. I remind them that healthcare settings are designed to reduce risk precisely because doctors understand these dynamics. Gloves, masks, hand hygiene, and training exist for a reason. When those measures are in place, even close care becomes much safer. To help people picture this more clearly, it can be useful to compare Nipah virus to viruses we know better. Think about influenza or the common cold. Those viruses spread easily through everyday contact. A shared room, a cough across a table, or a brief conversation can be enough. Nipah virus does not behave that way. It does not move freely through the air during normal activities, and it does not spread efficiently through short encounters. Another comparison some patients find helpful is with viruses that require blood contact. Those viruses also depend on very specific conditions to spread. Nipah virus sits closer to that end of the spectrum than to highly contagious respiratory illnesses. This biological reality is one of the reasons transmission remains rare and contained. In real life, most people will never encounter the conditions required for Nipah virus person-to-person spread. Daily routines like shopping, visiting family, attending appointments, or enjoying community events do not create the kind of exposure science has identified. This distinction matters deeply for seniors, whose health is supported by consistency and social connection. Understanding how transmission looks in real life allows fear to soften into perspective. It reminds us that not all viruses demand the same level of concern in daily living. When science describes close contact, it means something very specific. Knowing that specificity helps you breathe easier and stay grounded in the life you know. As a doctor, I have seen how powerful this clarity can be. It gives people permission to remain engaged with the world while trusting that medicine continues to watch carefully, quietly, and with intention. Nipah virus scientific evidence. Scientific evidence has a quiet way of speaking. It does not shout, and it rarely offers absolute statements. Instead, it builds understanding piece by piece. When it comes to Nipah virus, the evidence we have comes from careful observation of real cases, laboratory studies, and long-term monitoring. Together, these sources help us separate what is true from what is often misunderstood. One common misunderstanding is the idea that because a virus has been shown to spread between humans, it must do so easily or often. Science does not support that conclusion. The evidence shows that Nipah virus transmission between people has occurred only under narrow conditions. These cases were documented precisely because they were unusual. If transmission were common, it would appear frequently and consistently across many settings. That has not happened. Researchers study patterns. They look for repetition, scale, and consistency. With Nipah virus, what they see is limitation. Transmission requires specific circumstances, close contact, and prolonged exposure during serious illness. Outside of those conditions, the virus does not appear to move efficiently from person to person. This is a key scientific finding that is sometimes lost in public discussion. Another area of confusion comes from how scientific language is used. When researchers say a virus can spread, they are describing a possibility, not a probability. Can spread means that under certain conditions, transmission has been observed. It does not mean that spread is expected in daily life. Science is careful with words because words shape understanding. Overstating risk can be just as harmful as understating it. I often explain to my patients that science prefers caution over certainty. It leaves room for nuance. That is why you will hear phrases like may occur or has been documented in limited cases. These phrases are not signs of uncertainty or fear. They are signs of responsibility. They reflect a commitment to accuracy rather than alarm. The evidence also shows that when proper care measures are in place, transmission drops sharply. This tells us something reassuring. Human behavior and protective practices matter. The virus does not overpower systems that are attentive and prepared. It responds to boundaries, and those boundaries are well understood in healthcare. For older adults, this scientific perspective offers comfort. It shows that much of what causes worry comes from interpretation rather than data. When evidence is read carefully, it paints a picture of rarity, control, and preparedness. Science does not ask us to be afraid. It asks us to be informed. By understanding what the evidence truly shows and why language is chosen so carefully, you gain the ability to listen without panic. Knowledge becomes a steady companion rather than a source of stress. That is the quiet strength of scientific evidence when it is allowed to speak in full context. Understanding risk for older adults. When conversations turn to risk, especially for older adults, emotions can rise quickly. I understand this deeply because I have spent much of my career sitting across from seniors who want one simple thing. They want to know whether something truly applies to their lives. When it comes to Nipah virus human infection risk, the answer is far more reassuring than many people expect. From a medical standpoint, risk is never a single number. It is a combination of exposure, environment, health status, and behavior. For most seniors living in the United States, Nipah virus does not intersect with daily life. The conditions associated with infection are highly specific and uncommon. They are not found in grocery stores, community centers, family gatherings, or routine medical visits. I often remind my patients that age alone does not place them in danger. Risk does not come from being older. It comes from being in certain environments, under certain circumstances, for extended periods of time. Nipah virus human infection risk has been associated with close and prolonged exposure to someone who is already severely ill, often without protective measures. This is not how most seniors live their lives. Many older adults already practice habits that support safety. Washing hands, maintaining personal space when someone is sick, and following medical guidance are part of everyday wisdom. These habits quietly protect health without disrupting routines. There is no need for dramatic changes, isolation, or fear-driven decisions. The science simply does not support that response. I have had patients ask if they should avoid travel, stop seeing family, or limit normal activities. My answer is grounded in evidence and experience. There is no indication that normal social interaction increases risk for Nipah virus infection. In fact, maintaining connection and routine supports emotional and physical well-being, which is especially important as we age. Understanding risk also means recognizing what we do not need to worry about. Seniors are often targeted by alarming headlines because fear captures attention. But fear is not a health strategy. Clarity is. When you understand where risk truly exists, you can let go of imagined threats and focus on what strengthens you: good nutrition, movement, rest, and peace of mind. At this point, if you are finding this information helpful, I want to pause for a moment. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. As we move forward, keep this in mind. Risk is not everywhere. It is specific, limited, and well understood. When you know that, confidence begins to replace worry, and health feels steady again.
Daily life safety and routines. One of the most powerful protectors of health in later life is something very simple and often overlooked. It is routine. In my years of caring for older adults, I have seen again and again how familiar rhythms support both the body and the mind. When life feels predictable and steady, the nervous system relaxes, and that calm state allows the body to function at its best. Daily routines give structure to the day. Waking at a familiar time, preparing meals the same way, taking a walk, reading, or spending time with loved ones all send a quiet message to the body that things are safe. This sense of safety matters deeply as we age. It lowers stress hormones, supports sleep, and helps the immune system do its work more effectively. From a medical perspective, stress is not just an emotional experience. It has physical consequences. Chronic worry can weaken immune response, raise blood pressure, and disrupt digestion. When seniors are pulled out of routine by fear, even well-intentioned fear, the body often pays the price. That is why maintaining normal daily life is not only safe in situations like this, but beneficial. I often tell my patients that their bodies recognize familiarity. They respond to it with balance. When you continue your regular activities, you are reinforcing signals of stability. This helps immune cells communicate properly and respond calmly rather than in a constant state of alert. In simple terms, feeling safe helps your immune system stay strong. This is especially important when discussing rare health concerns like Nipah virus. Because the risk is not tied to everyday activities, there is no medical reason to change routines that bring comfort and meaning. Social connection, gentle movement, shared meals, and rest all remain essential parts of healthy aging. Removing these elements can do more harm than good. Caregivers also play a role in protecting routines. When caregivers remain calm and steady, that calm transfers to the person they care for. Anxiety can be contagious, just as reassurance can be. In homes where routines are respected, people tend to heal better, sleep better, and feel more secure. I have seen seniors thrive simply by staying grounded in their daily lives. Health is not only about avoiding illness, it is about creating an environment where the body feels supported. Safety is not just physical, it is emotional. When seniors feel safe, their bodies respond with resilience. As we continue this conversation, remember that maintaining your daily routines is not ignoring science, it is honoring it. Science tells us that stability, calm, and familiarity are powerful allies in health, especially as we grow older.
Transmission facts versus fear. One of the most challenging parts of modern health conversations is separating facts from fear. Information moves quickly, but understanding moves slowly. As a doctor, I have watched many older adults absorb fragments of medical news and fill the spaces in between with worry. This is not a weakness. It is a natural response when clarity is missing. Facts are grounded in evidence. They come from documented cases, repeated observations, and careful review. Fear, on the other hand, often grows from speculation. It takes a single word or headline and imagines outcomes that were never observed. When it comes to Nipah virus transmission, the difference between these two paths is especially important. The factual record shows that transmission between humans has occurred only in limited and specific circumstances. These situations involved close, prolonged exposure during severe illness. Fear begins when those facts are stretched into everyday life. Suddenly, ordinary activities feel risky, even though no evidence supports that conclusion. This is how misunderstanding takes hold. I encourage my patients to pause when they encounter alarming information and ask a few gentle questions. Where did this information come from? Is it describing what can happen under rare conditions or what usually happens in daily life? Does it explain the circumstances clearly, or does it rely on emotional language? These questions help bring facts back into focus. While choosing medical information carefully does not require scientific training. It requires patience and discernment. Trusted health sources tend to speak calmly, explain limitations, and avoid absolute claims. They acknowledge uncertainty without creating panic. When information feels rushed or dramatic, it often deserves a second look. Another helpful approach is to notice how your body responds to what you are reading or watching. Fear-driven information often creates tension, urgency, and restlessness. Factual information, even when serious, tends to leave room for understanding and calm. Your emotional response can be a useful guide. For seniors, protecting mental and emotional well-being is part of protecting physical health. Constant exposure to alarming news can raise stress levels and disrupt sleep. Choosing when and how to engage with health information is a form of self-care. In my practice, I have seen how relief follows understanding. When patients learn the actual boundaries of risk, their worry softens. They begin to trust their routines again and feel grounded in their bodies. Facts do not demand fear. They ask for attention and context. When you learn to recognize the difference, you reclaim control over how information affects you. Knowledge becomes a tool for confidence rather than a source of distress, and that shift is one of the healthiest choices an older adult can make. Role of public health systems. One of the reasons serious health threats rarely disrupt daily life is because public health systems are always working quietly in the background. Their role is not to alarm the public, but to observe, prepare, and respond long before most people ever feel an impact. This quiet work is especially important when it comes to rare viruses like Nipah. Public health surveillance is built on watching patterns rather than reacting to headlines. Hospitals, laboratories, and health departments share information continuously. When an unusual illness appears, it is examined carefully. Questions are asked about where it came from, who was exposed, and whether there is any sign of wider spread. This process happens methodically and without urgency because accuracy matters more than speed. Many people assume that if something is truly dangerous, they would hear about it immediately. In reality, the opposite is often true. When systems work well, problems are addressed early and discreetly. Isolation measures are introduced in healthcare settings. Protective equipment is used. Contacts are monitored. These steps prevent escalation, which is why the public rarely sees the full scope of what is being done. I have worked alongside public health professionals for many years, and what stands out most is their patience. They understand that fear spreads faster than illness. Their goal is to limit risk while preserving normal life. That balance is especially important for older adults, whose health depends on stability and routine. Disease surveillance also allows scientists to learn without causing disruption. Data is collected, trends are analyzed, and guidance is updated quietly as needed. This ongoing attention ensures that if conditions ever change, systems are ready to respond thoughtfully rather than reactively. For seniors and caregivers, this means you are not expected to manage complex health threats on your own. There is a structure in place designed to protect communities as a whole. You benefit from layers of preparation that operate out of sight but with great care. Understanding this can be deeply reassuring. It explains why rare viruses do not suddenly appear in everyday life, and why calm guidance often follows early concern. Much of what keeps communities safe happens before fear has a chance to take root. Public health is most effective when it remains unobtrusive. Its success is measured not by headlines, but by the absence of crisis. Knowing that this quiet protection exists allows you to live with greater confidence, trusting that many hands are working steadily to keep you safe. What research findings really mean? Research findings can feel intimidating at first glance, especially when they appear in the news without explanation. As a doctor, I have learned that the way information is presented often matters more than the information itself. Understanding how to read scientific findings calmly is an important skill, particularly for older adults who value clarity and steadiness. Scientific studies are designed to explore questions, not to deliver warnings to the public. When researchers publish findings about a virus like Nipah, they are describing what they observed under specific conditions. They are not predicting what will happen to most people. A study might explain how transmission occurred in a particular setting, among a particular group, at a particular time. That context is everything. One helpful approach is to notice the language used. Research papers often use careful words such as may, can, or has been observed. These words are chosen deliberately. They signal possibility, not expectation. When those words are removed or simplified in headlines, meaning can shift. What was once a narrow observation can suddenly feel like a broad threat. Being informed means understanding limits as well as findings. It means recognizing that a single study does not define reality. Science builds knowledge through many studies over time, comparing results and refining conclusions. That process is slow by design because accuracy matters more than speed. Alarm often arises when early findings are treated as final answers. I encourage my patients to ask gentle questions when they encounter new research. Who was studied? Where did it take place? How often did the outcome occur? Does this reflect daily life or a specific circumstance? These questions bring perspective back into the picture. There is also a difference between learning and worrying. Learning expands understanding and brings a sense of control. Worry tightens the body and narrows focus. When information leads to tension rather than clarity, it may be missing context. Trusted health sources aim to inform without creating distress. They explain uncertainty and emphasize what remains stable. For seniors, protecting emotional well-being is part of staying healthy. Constant exposure to alarming interpretations of research can erode confidence and disrupt routines. Choosing when and how to engage with health news is an act of self-care. Being informed is about staying grounded. It allows you to acknowledge that science is paying attention while trusting that your daily life remains safe. Being alarmed pulls you away from the present and into imagined outcomes. When research findings are understood properly, they serve a reassuring purpose. They show that systems are learning, improving, and preparing. They remind us that knowledge grows quietly, without urgency. In that quiet growth, there is space for calm, confidence, and continued living. Thank you for staying with me until the end of this conversation. Your time and attention matter, and choosing to listen with an open and thoughtful heart is already an act of care for yourself. As we close, I want to gently return to the central message of this video. Understanding Nipah virus. Human transmission is not a story about fear. It is a story about balance. It is about knowing enough to feel steady, without allowing worry to take over the space where peace belongs. Science was never meant to frighten us. It was meant to guide us with clarity and calm. In my many years as a physician, I have learned that the body responds best when it feels safe, respected, and unhurried. Especially as we grow older, health is supported not by sudden changes, but by trust in familiar routines and confidence in our own resilience. Your body carries wisdom. When it is allowed to rest in that wisdom, it does remarkable things. I also want to speak directly to caregivers who may be listening. Your calm presence, your patience, and your steady reassurance are powerful forms of care. Often, healing does not come from doing more, but from being present without fear. That presence matters more than you may ever realize. If there is one feeling I hope you carry with you after this video, it is reassurance. You do not need to change how you live. You do not need to carry concern into your daily moments. Knowledge can coexist with peace. Senior Health Daily is here as a quiet place to return whenever questions arise or clarity is needed. If this space has brought you comfort or understanding, I invite you to stay connected with us. Together, we will continue walking this path with trust, patience, and gratitude for the bodies that have carried us this far.